Well, we'll go ahead and get started, and then I'll just keep adding as people log on. Hi, everyone. Thanks for joining us. My name is Pam Bicklin. I'm the Program Director for Iowa Caregivers. We also have Marianne Young. She leads our Mouth Care Matters program, and she's also on the line, but having some microphone issues, so you'll be able to see her, and she can wave. I think she's just logging back in here. I wanted to start out just by thanking everybody for joining us, and wanted to also just point out a few things on Zoom. I know some people may be joining Zoom for the first time. We are going to be recording this session so that we can post it and have it online for people to view it at later times. So I wanted to make sure you all knew that we're going to be recording the session. Also, if everybody could mute their microphones during the presentation, that way we don't have any background noise. And I can also help mute people as well if you aren't sure where that's located. Usually it's down at the left-hand side of your screen. I wanted to recognize our sponsor for the program. Central Iowa Works has provided funding for us to be able to do some of these programs. And then as well, welcome Robin McNeil, who is going to be presenting today, the in-service on Mouth Care Matters. And she's been working as a Mouth Care Matters instructor for quite a while, but I'll let her introduce herself more. She's with the College of Dentistry at the University of Iowa. And Robin, you can take over.
Okay, thanks, Pam. Hi, everybody. I'm Robin McNeil. I work at the University of Iowa College of Dentistry and the Geriatric and Special Needs Department. We serve geriatric patients and adult special needs patients primarily. My job here as a dental hygienist, I'm typically in the clinic 2 days a week, and then 2 days a week. Right now with COVID, this is not happening, but typically I would be in the nursing home setting, serving nursing home patients, providing oral care, oral screenings, teeth cleanings, fluoride programs. And then on Fridays, I would either be in the clinic or out on one of the fluoride programs. Like Pam said, I've been a Mouth Care Matters instructor now for, I think, going on maybe 3 years. And I really enjoy helping them out and giving their classes. And hopefully you guys today will take some things away from this course and gain some information and maybe use a few new things with your residents. On this slide, it shows other offerings for future trainings. There's an 8-hour class, and I'll let Pam talk a little bit about these in a second. And there's also 3 1-hour classes. And so at the bottom, there's a link to Iowa Caregivers, and we'll also give you some more information at the end of this program on how to get more information. Pam, do you want to talk a little bit about offerings for MCM?
Sure. As with everybody else, we've changed the way we do things because of COVID-19. So we're switching a lot of the programs to an online format or Zoom format. And so we're excited you guys are a part of some of the first Zoom in-services that we're doing. So that's exciting. And the 8-hour class, we will have an option later this year to do the full 8 hours via Zoom. We're working with DMAC and the College of Dentistry, Robin, and some other dental hygienists who are Mouth Care Matters instructors to get that set up. So you may have the opportunity to attend the full class if you're interested. And then as far as the other in-services, we kind of schedule those as a on an as-needed basis, and we can do that via Zoom right now. So our hopes are to eventually get back to in-person because that's the most fun and the best way to learn some of those hands-on skills. But for now, we are going to be utilizing Zoom. So I think that's it for those.
Thanks, Pam. I also wanted to add, 'cause I always think it's important to know like how, where the person comes from and how much experience they have. And I've been in dentistry since 1994. And like I said, I work here at the College of Dentistry, and I am in the midst of getting my master's degree. Somehow I got talked into going back to school in my mid 40s. And so so it's very interesting at my house. I'm in online classes. My kids are in online classes. So things are a little bit crazy. So I'm well versed in using Zoom, and I hope you guys enjoy the presentation today. So this first slide is a slide that we're showing just some stats for you, talking about homebound care in nursing facilities. So, I know a lot of you are doing homebound care, and you can just take a look at it and see what you think about the stats, and if there's any stat that is surprising to you, if there's anything you want to comment about with one of these stats, please let me know. I will tell you on the nursing home side of it is these stats are from 2012. I almost think they're a little bit low compared to what I see. The gingival inflammation, it says severe. So severe would be, the end of the road in inflammation. I would say not the end of the road, but inflammation overall. I would say probably about 90% of the nursing home residents have some form of inflammation. Severe inflammation, definitely less, but oral care has definitely been a struggle in the nursing homes, and I'm sure that you guys see your own struggles at the home care as well. And by all means, during this presentation, if you guys have a comment or a question or something you want to know more of, there's a chat box at the bottom that you can type a question in, and Pam will interrupt me and let me know your question. And feel free to ask any question you want, or if you have a comment, feel free to just unmute yourself and blurt it out. You will not be interrupting me at all. So if you see something that you want to comment on or have a question, just please let me know. And so today we're going to talk a lot about the health of the mouth and how it affects the entire body. And here's two pictures of people that if they didn't have teeth, they would look very differently. So we can see how teeth affects of everything about how we look and how we function. And so I'm just going to load this up here so we can talk about it. Whoops. So oral health allows people to do a lot of things, and a lot of these things we take for granted because most of us, are able to care for our teeth. Our teeth are in good shape. We're able to eat. We're able to digest, enjoy the foods we like, speak clearly, maintain our appearance. And for most people, we do like to smile. And believe it or not, the nursing home residents I see, they have these same goals in mind. They want to have teeth that function. They want to be proud of their teeth, and they want to be able to smile and socialize. So we're going to talk about some dental terms that you probably are familiar with already. When you go to the dentist, they talk about plaque a lot. And plaque is the film that forms on your teeth within seconds after eating. Right away, it's a colorless film. If it would build up and stay on there longer, it would turn to kind of a white, thick appearance. And that plaque, that film, has a whole bunch of germs in it. And if it's not brushed off, that's the germs that lead to decay and lead to gum disease. And just to back up, a lot of people ask me, like, what's the difference between plaque and calculus? Plaque is the soft debris that forms on your teeth, and then calculus is the hard debris. That's the debris that we clean off your teeth when you come to the dentist. And so this gives you a little illustration of the germs meet the food and the acid, and then sits on your tooth and then becomes decay. And I think it's important in this slide to point out that it's not just sugar or candy that causes this. It's any kind of food debris that sits on your teeth will do that same breakdown. So cavities. stickier foods are definitely more of a problem than non-sticky, and the frequency is a problem as well. How long things stay on your teeth, how often you eat matters, and what the type of foods that you eat matters. So like the limiting to sugar and starchy foods. So for instance, I like to use it Mountain Dew example. So if you were drinking a can of Mountain Dew, it's high in acid, high in sugar, and you sipped it, that's much worse than just drinking it all down at one time, because it's going to decrease the frequency and decrease how long that acid stays in your mouth. Now, optimally, if you had to have a Mountain Dew, you drink it through a straw so the acid doesn't touch your teeth. Are you still going to get some residual acid from drinking that Mountain Dew? Absolutely. But all of these factors matter. Gum disease. I like to explain gum disease and the process that happens in your mouth so you know exactly what's happening in the mouths of your residents. So on the left-hand side, you'll see that the gums are, in this picture, they're pink, they're pointed, the bone level is higher than on the right side, and that would be someone who has a healthy situation. If you have gingivitis, that is an acute situation. So that's something like, if let's say you got a piece of food stuck in your gum and your gum got red, that's an acute situation that you can clean out, the gum's going to clear up. Periodontitis, which is a chronic disease, is like on the right hand side, where you've had inflammation, the inflammation did not get taken care of, it stays there. That inflammation then gets more complex, the bacteria get more complex, and then start eating the bone on the side of your teeth. So if you've ever heard somebody say, I've never had a cavity in my life, but I lost all my teeth because they got loose, that would be due to periodontitis. And so that is basically the difference between the two. Gingivitis is acute, you can reverse. Periodontitis, when you get it, it's chronic. Once it's yours, it is yours for the rest of your life. What happens in your mouth does not stay in your mouth. We do not want it to stay there. So next, we're going to talk about the whole healthcare connection and how your mouth affects the whole rest of your body. So notice in this diagram all of the red, and where that red goes to. It goes everywhere in your whole body. So this, when you're looking at somebody that has a dirty mouth, now it can be dirty like your mouth and my mouth, and we go to get our teeth cleaned. Same thing. It doesn't have to be as bad as this person on this picture. The same bacteria that's in your mouth is the same bacteria that's flowing through your whole body. It goes through your whole bloodstream. So for instance, when you go to the dentist and they clean your teeth, and let's say they're cleaning and an area bleeds because it's a little inflamed there, you had some debris under your gum line. That process is flowing everywhere in your body that blood flows. So the germs from unclean teeth can enter your bloodstream through the infected gums, and then it can go to all these important places like your heart, your lungs, your kidney, and your joints. But everywhere, it goes everywhere. And so in talking about inflammation and compromising your body, obviously the elderly is going to be much affected by this, or any kind of immune compromised patient if they have poor oral care. So this slide, I think, is really a good slide to explain bacteria in your mouth and the effects of it, because on the right-hand slide is like a sore like you'd find on your arm or your leg. So this sore is a sore that didn't get treated, didn't get cleaned up. So if you were to come across a resident like this, you would see this and you'd be like, oh man, we need to treat this, we need to clean it, we need to put some medicine on it. Well, the same sore, the same breakdown is happening on the left in the mouth. But people think, oh, it's their mouth, it'll be fine. Well, it's the same process. So that same inflammation, that same gunk, that same infection is going to go through their whole body, and the same thing will end up happening like it would on that arm or that leg. And so having a healthy mouth reduces all of these things here listed. And most of our residents we deal with have some kind of medical complication that having good oral care could help. And COVID-19 is in question mark because, as you guys know, on a daily basis, COVID-19 is changing, and what we know today is changing tomorrow, and they're still trying to figure it all out. So question mark on that. So next we're going to specifically talk about diabetes. So gum disease, with patients that have diabetes, their blood sugar is definitely affected by their oral care. And I find patients that the better their oral care, the better their A1C score is. If their A1C score is high, when I go to look in their mouth is going to be more of a disaster than it was the last time I saw them. So having that clean mouth, keeping that inflammation low, helps their A1C score and vice versa. And again, strong predictor when it comes to the complications of diabetes. So now we're going to talk about aspiration pneumonia. So with aspiration pneumonia, this same bacteria, the same plaque that's on the teeth, the same food debris that builds up in the mouth, if it's not brushed away, that can be aspirated into the lungs. And that same breakdown, like you saw on that sore on the arm or the leg that we saw, is going to happen in the lungs, and therefore turns into a bacterial infection and becomes the aspiration pneumonia. Hold on one second here. There we go. And I'll load this up for you. And as you guys know, it's the #1 cause of death in nursing homes. And we're going to see a slide in a little bit, but oral care can decrease this by a lot. And you'll be surprised at how it decreases mortality and effectiveness in costs and health of patients. So here is that slide. And so at the top, it's just kind of reminding you of the perfect storm. You've got the bacteria and the viruses, they're aspirated into the lungs. You've got an immune compromised person. Perfect storm for this to happen to. So then we have to decide, okay, how can we prevent this from happening? Well, education, protocols, supplies. For instance, we'll talk about a little bit about daily care in a little bit, but having the supplies to properly clean their teeth and what that might be for each resident can be different. And we'll get into that in a little bit. And then in the bottom of the slide, it just shows you some statistics that I think are pretty, and you know, I thought I was shocked myself to see how much this helped and how cases were avoided, how many lives were saved, and the money that was saved just in making these changes in oral care. So now we're going to talk a little bit about COVID-19. And like I said before, COVID-19 and the oral cavity, they are really still trying to figure it out. And these are the few things that we know. So signs and symptoms, sore throat and a skin rash. Only 29% of the people have skin rashes. So not everybody are going to have the skin rash, but if you have a resident and you're doing an oral inspection, if they have this red speckled rash, and I think I had read somewhere that kids especially were showing up with this rash. So if you have a child at home that if they don't feel good, check their mouth, see if they have this speckled rash. It is an indicator of COVID-19. And so one of the relationships they're looking at is oral health and COVID-19. Well, they're assuming at this point, just because of all the other conditions we've talked about, having that higher bacterial level, having that higher inflammation level makes you more immune compromised, which getting COVID-19, the effects of how you would fare with that would definitely increase your risk if you didn't have good oral care. And so something especially to keep in mind with, since we're in this pandemic and the awful effects of COVID-19 and the deaths related to COVID-19 with our elderly patients. Protection. So at College of Dentistry right now, our protection that we are wearing, we have like a hat, like a bouffant. We have safety glasses, we have a face shield, we have a mask, we have a gown. Depending on the procedure, we have arm sleeves, and we have things to cover our shoes, depending on the procedure. And right now, the biggest factors to protect on your body are your eyes and your mouth. And so I would really encourage you to protect yourself when you're giving oral care with your residents, because you are within that 6 feet. And depending on all the steps that you're going to be doing with their hygiene that day, it's not just their oral care. You may be spending 15 minutes with them in close contact. So important to wear that PPE. Another thing we do here at the college is we do a pre-rinse. We use there's 2 listed here. There's a chlorhexidine and a hydrogen peroxide rinse. We are using the hydrogen peroxide rinse that they make for us in the pharmacy here. Now, during home care, you're not going to have access to these. If some patients are on chlorhexidine, and so you can use that if you have it. But if they're not, and it's something that you want to implement with your residents, make sure that it's alcohol-free so it doesn't burn their tissues, and it has some kind of antibacterial effect to it. And you would brush it on their teeth. I personally, because the mouth rinse is over the counter, say that you have to brush for 60 seconds to be effective. I would do a full 60 seconds with the mouth rinse. And then what it's supposed to do is lower the bacterial levels in the mouth to make it safer for you to be in there. Whether or not that's something that you guys want to consider is up to you, but I just want to let you know that how we're handling oral care here at the college. So now we're going to talk about normal and abnormal conditions. So anything that you see, make sure that you assess, you observe, you report, you refer if needed. Please speak up and document. That will just protect your residents and it will protect yourselves. When we are doing a dental screening, there's multiple things that we're looking for, and this just is a small checklist. We're looking for their dentures. Do they fit? Do they not fit? Are they broken? Do they have teeth? No teeth? Do they have any ulcers, lesions, cavities, broken teeth, bleeding gums, discomfort, facial pain? Are we not able to examine them? That's important as well. And if none of them are present, it's also important to say they're within normal limits. This is a form that is out there. We don't personally use this form, but it is a form that's available. And basically it's a way to rate your resident on. So after today, this will make more sense once we go through the abnormal and normal, but you can use a form like this to rate what their teeth, the status of their teeth are, give them a score. So if you're unsure of, okay, is this person needing a referral to a dentist? Is this something I should bring up to a family member? It's somewhat of an easy way to kind of maneuver through that. So first we're going to talk about lips. On the left, that is the person that has pink lips. They're light pink, they're smooth, they're moist. That is a healthy lip. The middle pictures are showing lips that are dry, they're cracked, and they're red at the corners. It's super important, especially with the dryness coming with the cold weather, that you pay attention to those corners of the mouth. Now, you have to decide, are they cracking because they have dry lips, or are they cracking because they have a yeast infection in the corner of their lips? So what I would suggest is start out with like a petroleum jelly or a Vaseline, whichever you recommend, in those corners of the lips and see if it clears it up. If it's not clearing it up in 7 to 10 days, then I would gather that it may be a yeast infection. And then there's a medicated cream for that they'd place there. If it goes, and usually there can be some scabbing that will happen as well with that, the cracking of that. And if you see scabbing at all, then you want to go straight to the medicated cream. On the right-hand side, and you can see, but to back up to the middle slide, on the bottom slide, you can kind of see on the right-hand side where the person's just starting to get a little bit of that scabbing, and to where we would know right away that, okay, we want to treat that. On the right-hand side, this is a person that's it's gone too long, and they're starting to get this white appearance, it's scabby. That would be the yeast infection in the corner of their mouth that they need to get treated for. The middle slide is oral cancer. And oral cancer can come in all different colors, shapes, sizes. So important things to think about when looking at your residents is, one, is it in just one place, or do they have it in multiple places? Has it changed in size, color? And think about, kind of think about your viral timeline, that 7 to 10 days. Is it clearing up, going away? Or nope, it's not clearing up. Maybe it's even getting a little bit bigger. Then that'd be something you want to check out. And it's important when you're doing your examination, and we'll talk about this. I'm just gonna wait on that point. I'll talk about that when we get to the tongue to not confuse you. And then the bottom slide has ulcer. That can be from either a denture, or it can be from someone that has a bite, that they're chronically biting their lip because of the way their teeth are coming together. Maybe they have a broken tooth, or something's chipped, their bite is off, and they need to see the dentist, because if not, it's just going to keep lacerating that. So again, if you don't see it going away, there's probably some problem associated with that. So teeth, we do not expect you to be a dentist. So when you're looking at people's teeth, you have to just kind of make a gander. Do their teeth look healthy? Do they have a good appearance to their teeth? Doesn't matter if they're crooked, doesn't matter if they're weird shaped, doesn't matter if they're dark in color. Do you think that these are, uniform, normal teeth? The middle slides show you teeth that are broken. The top one is decayed. The middle one probably has some decay and is broken. And then the bottom slide is a molar tooth that's been broken off at the gum line. Things to think about is ask your resident if they are able to verbalize to you, do you have any pain? Have you had any swelling? Does their cheek feel warm? Any of those things to figure out if an infection's going on. Sometimes too, you'll see like a white yellowish substance pooling. If you ever see that, that is pus, and that would mean that there is an infection there. On the right hand side, the top side is showing everything: decay, gum disease. That would be someone that it shouldn't look that bad. So that's someone that just has not received care in a very long time, years. Who knows if they've been to the dentist in their adult life. And then the middle slide is what we call root decay. They have decay along their gum line. With elderly patients especially, they tend to get more decay at their gum line than on the tops of their teeth because of the way their food packs in there. And so real important to be checking out that gum line, check out the corners to make sure that nothing's just sitting in there. And then the bottom slide shows you teeth that are broken and decayed. And at this point, you'd probably think, gosh, isn't this person in a lot of pain? But I call like this the person of, this is the point of no return. Like they probably were in pain like years ago, and their teeth have died, and now they're just sitting in there like that. But it doesn't mean that it should stay that way. So now we're going to talk about the tongue. So before I said I was going to hold that thought. So to inspect the tongue, you can either have your resident stick your tongue straight out, and you could look at it like this person's doing it, kind of pull it side to side with your gloves, or you can tap on their cheek and have them open and say, put your tongue over here, put your tongue over here. But you want to check the sides of their tongue, because that is a common place for oral cancer. So they have a lesion or a bump on the side of their tongue, that's something they want to get checked out. Their tongue should look moist, and their tongue should look uniform and pink. And so the middle slide shows you that there's fissures in that top tongue. And those fissures, it's red, it's fissured, that's the sign of dry mouth. The bottom slide has some fissures and it's coated. Well, that coating is bacteria on the tongue, and that is someone that does not brush their tongue. So they have this bacteria buildup, and you can see towards the back of the tongue, there's even kind of a brownish spot, because the bacteria get thicker as you get towards the back of the mouth and the back of the tongue. And so they, as well as brushing their teeth, they need to brush their tongue. And if you have someone with bad breath, definitely will help with bad breath if they're brushing their tongue. I would do that step last, because you're going to get kind of like a sludge on their toothbrush. So you want to be somewhat close to a sink, because you'll brush it, rinse it, brush it, rinse it, kind of thing. Or like have a Dixie cup where you can like dip your toothbrush in. And then the right slides are a red fissured tongue at the top. This is someone that has severe dry mouth. Their tongue is red, it's ulcerated, it probably hurts. So there's someone that probably will have a preferred diet because it hurts to eat. The middle slide is that side of the tongue where this is some kind of lesion, whether it's oral cancer or not, it's a lesion that is abnormal. So it'd be something to watch. The bottom slide is more of like a denture sore. And again, this, if it's not oral cancer, but the problem is it's like a blister that keeps getting rubbed and rubbed and rubbed, so it can't heal up. And so that means their denture needs to be adjusted, whether it needs to be relined, it has a rough spot that needs to be adjusted, but that spot's just going to keep getting blistered. So the gums and tissues. Again, on the left, we're looking for the light and the pink. And the middle slide, you'll notice at the top is there's red rings around the top teeth. And you'll see the white plaque. So the gums are inflamed there. And then the middle slide, you have some inflammation with decay, broken teeth. And then again, that bottom slide, it's harder to see, but if you look kind of in the ridge, beside the ridge of their mouth, there's this redness there. And again, that would be a sore under a denture. So it may not be a white sore, it can be a red sore as well. So on the right-hand side, we talked about yeast infection on the lips. This is a yeast infection in someone's mouth. And if you're wondering, how can I tell if it's a yeast infection or food? Well, food will wipe off. The yeast infection will not. So you can try to wipe that area off, and if it won't come off, they probably have a yeast infection. So something to get checked out by their medical doctor or dentist. The middle slide shows someone that has not had their teeth cleaned in a really long time. They have plaque, they have inflammation. That big cloudy white stuff on the bottom is that hard calculus that I talked about. So that's, build up over a long time. And then the bottom slide is another form of yeast infection. This is a person that had an upper denture and that didn't have proper denture care and wasn't taking their denture out at night when they sleep. So there was a bacteria buildup that formed, and anybody that you can see when they take their denture out, if you can see that outline in their mouth, they have this. It's called denture stomatitis. Saliva. So for saliva, what we're looking at is we want it to be a moist, we want it to be fluid, free-flowing, just hopefully like our mouths are. The middle slide is what I call ropey saliva. It's real thick, and that's a person that is having dry mouth issues. Kind of they're in the middle ground. They have some saliva, but the saliva is not normal in thickness and texture anymore. And that can pose a problem for oral care because, one, they have dry mouth, so they're higher at risk for cavities and inflammation. And two, that ropey saliva just holds on to stuff. And so it's harder to get their mouth clean. And then on the right-hand side, you'll see the tongue it's red, it's fissured, you don't see any saliva. These are the severe dry mouth people. And these people will have the cracked lips, the yeast infection, and their teeth are not going to be in good shape. Their tongue's going to be sore. If their tongue is dry and red enough, it's sore, and it's hard for them to speak, eat, drink, everything. So think about like when you burnt your tongue, kind of that feeling. And so obviously if you see anything that's abnormal, please observe it and report it. And so now we're going to talk about why it's important. So obviously we talked about swallowing. It's a natural cleaner of your mouth. So it helps clean your mouth. It helps strengthen your enamel. And obviously it helps us taste food, swallow food, speak. Why do we get dry mouth? Dry mouth is called xerostomia. Medications. There are so many medications out there. We all take a medication that causes dry mouth, whether it's an allergy pill, heart medication, seizure medication. There's, you name it, there's tons and tons, thousands and thousands of medications that cause dry mouth. Other things would be cancer, radiation treatment, dehydration, alcohol use, smoking, mouth breathing, and age. So as we age, our mouth does get drier. So things you can do for dry mouth. At the nursing home, they're really good about having a water jug there with a straw, and the residents will use that throughout the day. And so I would suggest that to your home care patients, that if you see someone that you know that they have a drier mouth, or or you can tell by their breath or their tongue when they go to brush. You can make sure that they have water beside them so they can sip water throughout the day. Don't have them sip anything as their hydration that has sugar in it, because that will cause them decay. Same with the gums and the mints, make sure they're sugar-free. Xylitol is a really popular ingredient with sugar-free products that help with dry mouth. Obviously, their oral care. Again, if you're going to use a cough drop or any kind of hard candy, make sure it's sugar-free, so that wherever their candy is sitting there, they will get a cavity, because they typically put it in their mouth and put it in the same spot. And then other special products. We here at the College of Dentistry have Biotin samples, oral balance samples, and ACT samples. And one that I really like for the residents, it's by Oral Balance, and it's an oral moisturizing gel. Now here are the samples we get are in packets. I don't know, to be honest, what it looks like when you buy it in the store. I'll have to pay attention. But it's a gel liquid that squirts out of these packets, and you can just put it on obviously have your gloves on, but you put it on your finger, and then you line their cheeks, and then I put some on the top of their tongue, and this helps keep their mouth moist. They like it a lot. It does not have any real taste to it, and they can use this product as many times throughout the day as they want. It's nothing that will hurt them, harm them. It's just helping them keep their mouth moist. And I find that the gel lasts the longest. I feel like the mints and the cough drops and the gums, they help while they have it in their mouth, but then when they don't have it in their mouth, it goes back to being dry. Problems and signs to look for that will probably be that you'd want to think, okay, is there an oral problem here? So weight loss for sure, agitated at meal times, refusing to eat. All of a sudden the good eater doesn't want to come to the dinner table. Or they change their food preferences. They used to have like anything, and now they only want soft foods. They are touching their mouth, grabbing at their mouth, touching their cheek. They have facial swelling or warm or puffy cheeks. If they have a denture wear, all of a sudden they wore their denture all the time, and now they refuse to wear it. And that bad breath. Do they have bad breath? Now, I'm not talking just like daily, regular bad breath, like it's real distinct. Like, this is the worst breath I've ever smelled. There has to be something going on in there. So here's a picture of someone that was before staph and after staph. So you can see these patients, they pack a lot of plaque, they pack a lot of food. And like I said to you, most residents at the nursing homes have some kind of inflammation. And so I like this slide because CNAs will ask me, am I hurting them when I brush their teeth? Because I always see blood, or I always this. And I'm like, no. That is the natural way that your teeth clean themselves when there's something irritating them. So same thing, like once you've popped that pimple, you see blood come out. Well, that's your body's way of cleansing that area so it can heal up. So even though it doesn't look great, to them, they're not hurting or you're not doing something wrong. So please don't stop brushing their teeth because you see some blood, because you just know that you have cleaned out that area and it's trying to self-cleanse itself. So denture care, just as important as brushing your teeth. The same bacteria that build up on your teeth, build up on your denture, same process through your body. So here is a pair of dentures that were not getting cleaned. And you can see, just like the teeth, they had the same buildup, the same problems with bacteria, and that's going to cause that inflammation in the mouth, the yeast infections, all the bad stuff. Here's another good picture of a yeast infection and a patient that wore a denture that did not have their denture properly cleaned and also would not take their denture out at night. One thing I want to mention, if you are getting a medicated cream for a yeast infection that's under a denture or partial, it's easiest to place the medication on the denture or the partial itself, because then it'll go exactly where that infection is. Whether you guys trying to put it on your finger and smear it around where that red outline is, just put it straight on the denture and partial, and then they can use the medication throughout the day as they're wearing the denture or partial. If they have a metal partial, sometimes patients have their tissues are irritated from that metal, and you may get progress, but it's never quite healthy looking. Don't despair, because they may also be having some interaction with that metal, and there's not a lot you can do about that. But if you see it getting worse again, then you'd want to reapply the medication again. And so pointers and tips, with a couple of things with daily care, make sure you have the right size of toothbrush. I personally, with the nursing home residents, like to use child-sized toothbrushes. They're size 20. And I like the Oral-B ones. Like I said, they're size 20. It may have to be something that if you get like at a pharmacy or a special like order through a catalog. They do obviously have children toothbrushes like at Target and Walmart. I just don't know if you're going to find that size 20 or if they're going to be a little bit bigger. And also, they tend to really like the strawberry toothpaste. I really like the Tom's strawberry toothpaste. Make sure you get the fluoride version, and they have a fluoride-free version. Make sure you get the fluoride one. My kids like it. Special needs patients really like it, and the elderly patients really like it. And so if you have somebody that's combative or really resistant to oral care, big helpers are if they like the taste of the toothpaste, and if the toothbrush is small. I feel like getting in their mouth is easier, and if you have a gagger, the small toothbrush helps tremendously in getting their teeth brushed. And even if you have somebody that doesn't want to open their mouth and keeps their lips real tight, that size 20 is so small that you can just get a peek inside those lips with that toothbrush, and then it slides right in. And they don't even have to open their mouth, and you can still go around pretty well and brush their teeth. You may not get the insides the best, but you can still get the outsides pretty easily. So try those tips if you're having any problems. And on my patients that are just, I can brush their teeth, but they're just definitely not having it and they're not being super cooperative, I compliment them like they are the best patient of the day. And I feel like it sidetracks them almost, and they kind of look at me like I'm nuts. And then eventually they're like, their mind is kind of trying to reel like, what? I'm not helpful. I'm not a good patient. And in the meantime, I'm brushing away and they're focusing on what I'm saying. So do whatever works for you. Some people like to sing. Some people like to be really explain every step. With the patients that I see, my special needs patients definitely like to know what I'm doing and like the steps explained. The elderly patients, depending on the patient, I think would almost be annoyed by that. They just want me to get my job done. So do what's best for you guys. Again, prompt assist, perform oral hygiene. Again, one thing to watch is the patient that went from a good brusher to not being able to brush. And a couple of things that you can do that are easy to check on this is, one, make sure they have a toothbrush in their bathroom. I'll go into nursing homes and the resident will say, oh, I haven't had a toothbrush in 2 weeks, that my roommate stole it or something happened to it. So make sure they have a toothbrush. And number two, if they say, oh yeah, I brushed my teeth, we'll check their toothbrush. Is it wet? Because if it's dry, then you know that nope, they're not brushing their teeth. And so you can also have them smile at you, and then you can just see like, okay, is their food still stuck in their teeth? Are their gums fire red? Like, assess their job. And that can also help determine if there's someone that may no longer be able to be completely independent. Let's see. Follow recommendations by us, of course, and watch closely for changes and observe and report like we have already discussed. And of course, it takes all of us in this to make sure people have general good health. I appreciate everything that all of the nurses, the CNAs, all the home health care workers, all of you do such a great job and are so dedicated to your jobs. And just between yourselves, like I've said before, just make sure you communicate, document, ask questions. And then the goal of everybody is to, take somebody that's not so good, work with their daily care, and hopefully get them in a much better place. And this slide is a report from 2000, and that was the first year that they made the connection that good oral health affected the whole body. So it's not that long ago that they've made all these connections and come up with all of this good information about oral health and our bodies. And so lastly, I'm going to turn it back over to Pam, and so she can wrap up and tell you guys more about available sources here. And yep, I'll leave it there and see if you guys have any questions. Thank you so much for spending your afternoon with me. Feel free to ask me any questions you want.
Yeah, like I said before, we have resources on our website. It's www.iowacaregivers.org. There's several oral health articles that are available. So if you want to share with staff in newsletters and things like that. Also, if you have more specific questions about setting up a full 8-hour class or other in-services, you can email Mary Ann, and she'd be willing to help you with that. Or our main email address is information@iowacaregivers.org. We will be sending out a short evaluation for this program. So if we'll be sending that by email. It's a SurveyMonkey link, so you just click on it and then just go in and fill out the answers. It just takes a few minutes to do. Otherwise, if you don't have access to a SurveyMonkey link that we'll be sending out, we can get you a hard copy that you could fill out. For those of you who are with Wesley, Anne, if you have questions, Anne would be able to help you out with the SurveyMonkey link. Also, did anybody have any questions or comments? You can unmute yourself and go ahead and ask.
I have a question, Pam.
Yeah.
I tried typing it, but I don't know how this works. I haven't used Zoom before. I have a client who has Alzheimer's. She will not wear her dentures. She took them out and loses them or throws them, or so we don't even bother with the dentures anymore. But what I'm wondering about is, what should I be doing for her mouth?
Good
It
question.
seems like when I began caring for her, nothing was being done for her mouth. I found some of these little lollipop sponge sticks, and I would dip them in mouthwash and try to sponge out her mouth, but she won't let me do that. But I would be able to get it in her mouth and just let her suck on it. She won't. She doesn't know to move it around or anything. She'll just kind of gum it for a while. And when she loses interest, then I'll throw it away. But that's about the most I've been able to do with her.
So it's okay that she doesn't want to wear dentures. I would rather have her not wear dentures than never take her dentures out, because we see what problems that arise. But and it's amazing that some people can wear no dentures and have no teeth and eat amazingly. So as long as she is not losing weight and she can function and eat, then that's fine. She can, go without teeth.
Well, of course, we do try to give her softer foods, but she does eat quite a variety, and she does well. Sometimes she'll hold something in her mouth, and I don't know if she's chewing on her tongue or it's something left from lunch, but she will be chewing for a long time on something in the side of her mouth.
So typically, especially people that don't have teeth, they pack food in the corners of their mouth. And with not having teeth, their jawline changes with age, and they kind of get that kind of sunken look. So those pockets in the corner between our teeth, and those get deeper, those valleys get deeper. So they pack a lot of food. So my only concern would be, if you were never able to get in there and get that food out of there, that she would be one of those aspiration pneumonia cases. So without being there,
you would let me get my finger in her mouth.
Right. So like I said, without me being there to help you or to assist you with it, I can't tell you exactly. Definitely the swab, because she likes it. You know, obviously keep doing that because it's something. But and I can't think of like another product off the top of my head that would be better, because obviously she probably wouldn't want a toothbrush poking her. And the swab is soft, but I would just be, I guess what you could do, the only thing I would suggest, so if she'll have the swab in her mouth, is since she won't move it around, is if she would let you move it to another side and then she sucks on it over there, because then maybe that would flush the food out of those corners. That would be my only concern.
That would be hit or miss. I might be able to do that once in a while. They don't have the sponge sticks right now, and I was trying to get my information to give to her husband to try to convince him that that would be a good thing to have on hand and for us to be doing with her, because I'm not with her every day. I just relieve him 3 times a week and try to take care of her hygiene and everything on the days that I'm there. And her mouth is one thing that I've been curious about, what we should be doing better for her.
And typically, so even if I have a patient that won't open and they have teeth or no teeth, that getting, and especially if they don't have teeth, at least you don't have to worry about getting bit because she has no teeth, that getting some type of like gauze wrapped around your finger and just doing a quick swab of the left and the right of her mouth also would be way better than nothing.
Yeah.
But it does, if you're not someone that's used to like kind of powering through that, it's something you have to, it's a technique you got to learn and get used to. It's definitely, because I mean, those are stubborn residents.
She is not weak. She's very
And
healthy.
yes, they
Besides
are
her mom,
very strong. People think
she's
that
very
nursing home patients are
grabby,
weak.
so it's hard to do anything to her without her grabbing my hand and pulling on it. And I mean, even buttoning her shirt is a challenge sometimes because of her grabbiness. So
Yes,
being close to her mouth may be interesting.
yes. Is there anybody there with you that could hold her hands while you check her mouth quick so she doesn't grab you?
Sometimes her husband is there.
I would ask him to hold her hands, and like, and sometimes like husbands can be good if like, for instance, like let's say she really likes him, he sings a song that she really likes, so you know, whatever their connection is, that he can distract her, and literally it only has to be like a 2-second thing on the left and a 2-second thing on the right, but you're just trying to grab anything that's stuck in there so she doesn't aspirate it while she's sleeping.
Yeah.
And
Okay.
another thing, in the full 8-hour class, we go into more depth on dealing with challenging behaviors. So if she is,
I'm
bad.
sorry. In dealing with what? Your volume faded out for a minute.
In the 8-hour class,
Uh-huh.
we give more detail on dealing with challenging behaviors. And so there are several different techniques that we go over and kind of demonstrate and things in the 8-hour class. We don't really have time to do a lot of those now, but if you have more questions, that class might be good, or maybe we can get you more information on those.
No, that was very helpful. Thank you for your advice.
No problem.
Anyone else have questions?
I just want to say thank you again, Robin, for this education. It's very helpful and informative for our team members.
You are so welcome. I hope you guys can take away something today that help you with your residents and even your own mouth.
Definitely.
All right, if there are no other questions, we'll wrap up this in-service, and we'll make sure to follow up with an email survey that you can let us know how it went for you and how your experience on Zoom was. So thanks again, everybody.
Thank you.
Bye, everybody.
Bye-bye.
if you're having a hard time leaving the meeting, just hit the red button at the bottom right. There she goes. Spirit's probably like, how do I get out of this thing?
So, all right.
So one day done, and then back on Thursday for 9 and 1:30.